this is one of my favorite liberating structures, and we're going to do an exercise on this over on that little diagram over on the right-hand side. And actually, I have handouts for this one, which I put somewhere. Just a second. Here, it's probably more than enough. This is a liberating structure that really, I personally had a hard time wrapping my head around this in terms of what it was and what it meant. So I'm going to take you through it. And then, as I said, we'll do an exercise. I have found this to be one of the most eye-opening things out there. So let me take you through it. It's based on essentially ecology. The idea that in the bottom left-hand corner there, you give birth to something, let's say a forest. You've got a new bunch of new little saplings. They're going to grow. They're going to reach maturity. And then we all know about forests and forest fires. Forest fires are a natural event. At some point, the forest gets overcluttered. Things can't grow anymore. There's so much dead wood on the ground. The forest starts to stagnate. And that's when you need creative destruction, right? And you need to basically blow it up, come up with new ideas, lots of new seeds floating around. Then you give birth to new saplings. And it's this constant eco-cycle going around. So this has been used for business, and it's very, very applicable to healthcare. So let me take you through it again, now with a business model. So you give birth to an idea, your product reaches maturity, and then you can get stuck into what's called the rigidity trap, where this is the way we've always done it. I put a lot of time and effort into creating this product, to getting it to where it is today, and we're just going to leave it just the way it is. And you can get stuck in that rigidity trap. Now, can any of you think of a company, I've never asked this question outside of North America before, so this will be interesting. Can any of you think of a company that got stuck in a rigidity trap and the world passed it by? Polaroid. Kodak. Yeah. In Canada, it's BlackBerry. Right, remember those, vaguely? Blackberries? I don't know if any of you still use them or not. They had the majority of the smartphone market until about 7 years ago, and now whatever, right? You get stuck in the rigidity trap. You put so much time and effort into this thing that you don't want to touch it anymore. You just leave it the way it is. So if you're going to meetings or doing things where you're really questioning, why are we doing this? And people have told you it's the way we've always done it, that thing may be stuck in the rigidity trap. It takes enormous effort to blow through that rigidity trap and get into what we call creative destruction, where you're taking something that you've created and you're blowing it up, either partially or completely. By blowing stuff up, you create resources to be able to do new things. How many of you feel like things only ever get added to your plate and never taken away? Yeah, absolutely, right? It's just, there's always a new program, and nobody ever says, you know that thing we were doing 3 years ago? Yeah, stop doing that. Nobody ever says that. We just keep adding and adding and adding, and wonder why people can't do what they're supposed to do because they're overwhelmed. So you blow it up, you then get into renewal, new ideas floating around and things, and then there's the so-called poverty trap, which is you've got these great ideas but no money to actually do all of them. So you have to get very selective in terms of which things you're going to do, and then you give birth to that idea, and it goes around the eco-cycle. So this is useful for all sorts of things in life, looking at things you're doing in your own life, things you're doing at work, etc., looking at where you think those things are on the eco-cycle. Any questions about this so far? Yeah.
Can you clarify why you call it a poverty trap? Because in a way that's a reality trap, isn't it?
Reality, poverty is reality, yeah. No, but that's it. You could call it that, I guess. It's the idea that you've got all these great ideas, but not all of them are going to actually land and take root and actually start getting somewhere. And so you need to you can get into trouble there where you've got lots of ideas but never do anything. I was working with a group of physicians. The exercise we're going to do, I'll just sort of describe the exercise we're going to do, and then you'll see what I mean. So the exercise is, you got a bunch of Post-it notes on your table there. What I'd like you to do, you don't have to do it yet, but in a moment, look through your calendar on your phone or however you keep your calendar and look at some of the key things you're doing in your job. Key meetings you're going to, key projects that you're involved in, things like that. Write each of them separately on a Post-it note. And then what I'm going to have you do is walk over to that chart over there and stick them on the chart where you think they belong on the Ecocycle. Okay, so for example, you've just created a brand new hand hygiene program. It's, fresh off the farm, brand new thing. You could just plunk it near birth. Okay? Maybe you're going to the same meeting that you've been going to for the last 15 years and nothing ever happens. That's probably stuck in the rigidity trap. You may have a program that you have just completely redone. You've just torn it to shreds and you're just now rebuilding it. That would be in creative destruction. And you may have an idea for a thing, but you've never actually, you haven't started it yet. Or maybe you've got a great idea, but no money and it's stuck in the poverty trap. There are two other traps on here that I'll just briefly mention. One is the founder trap. So the idea of you've given birth to a thing, and this may be very applicable to you guys. You've given birth to something, a new program in your organization, but you know if you leave to go somewhere else, that's going to die. Or when you go on holidays, nobody cleans their hands. Right? They're all just running free. They all go feral. Right? So then your thing may be stuck in that founder trap, which I actually put on the drawing over there on the right-hand side. The other one is the total destruction trap, where you've blown stuff up so much, you can't put it back together again. The whole thing just kind of dies. So to use another business analogy, I do a lot of work in upstate New York, which is where Kodak is from. Kodak is based in Rochester, New York, which is right across the lake from us in Ontario. And whenever I bring this up, they all in unison say Kodak. Downtown Rochester is a ghost town because the entire town was founded on Kodak. And when digital photography, which they invented, interestingly enough, when digital photography came out, they didn't get it. They had invested so much into film that they weren't going to blow up what they had worked so hard to create, and now they're gone. Another company a bit different would be Apple, where they came up with the iPod, and then cannibalized iPod sales by creating the iPhone, and then cannibalized their laptop sales by creating the iPad, and then cannibalized those by creating the bigger iPhones, constantly blowing up what they created. Nothing is sacred at that company. It'll just go. They'll try it, it'll go. So I did work with a bunch of physicians at a hospital nearby mine where I was asking them to write down what they were doing and put them each idea on a Post-it note and stick it up on the board. And they had a whole bunch of stuff in renewal. Most of their Post-its were in renewal. And then I asked the group, what does that mean to you? And they said that we sit around and talk about all these great ideas, but we never do anything. And the whole group had never thought of it that way before, but because they had put it on something pictorial, they saw it with their own eyes, they suddenly realized that they have a problem. Right? Other groups that I've worked with, especially in healthcare, a lot of things in that top right-hand corner, a lot of mature programs that are inching closer and closer to the rigidity trap, but we don't want to blow it up because then it might be seen as a failure. Let me give you an example. In our province, we created the Just Clean Your Hands program, which is actually known quite a bit around the world. The Ontario government put a lot of money into it. It's based on somewhat based on the WHO 5 moments of hand hygiene, although in Canada we have 4. We're missing a digit. I don't know. Anyway, so, all sorts of tools and education and audit tools and all these things that were created for millions of dollars, posters, all sorts of stuff. This was created. it is now so stuck in the rigidity trap, it's almost meaningless. And unfortunately, I think the attitude of government is, if we blow this up, it looks like we wasted our money. Rather than, if you blow it up, you learn from this what you could. But innovation is all about blowing it up and starting over again and recreating and recreating. But we can get stuck there. So what I'd like you to do, take the Post-it notes. You probably only need, like, I don't know, 5 or 6 per person, maybe not even that many, of key things that you're working on that you think are worth, I know you're working on much more than that, but group them. Key things that you're working on that you can sort of define as discrete things. Put one on each Post-it note. And then when you're done, just come up and stick them on that map over on the right-hand side where you think they belong. Okay? So we'll give you roughly, 8 minutes or so to do that. So, as with the other liberating structures that we've done, it's a bit artificial because you're all coming from different areas, versus if you were all on one team if you were doing this exercise. So the purpose of today is to teach you how to do these, but I still think there's some value in seeing what people have done here. So what are your thoughts, your initial impression of where all the sticky notes are? Yeah, you're kind of right-shifted, aren't you? Yeah. So a lot going on in mature programs. One thing that I've seen over and over again is when things are stuck in the rigidity trap, a lot of people come up first and they're like, bam, right on there. Like, it's almost like they're angry. And so annoyed with that thing, whatever that thing is. And it's actually, now you can give it a name. This is stuck in the rigidity trap. You have a bunch of things, though, that you're actually in the process of reforming, changing, blowing up to some degree. Relatively few kind of new, just floating around ideas. Some things stuck in the poverty trap, and then a bunch of new things coming in. So in an ideal world, you'd like a balance across all 4 quadrants where you'd have stuff going on in each one. But this is all pretty typical to see a lot of things kind of right-shifted. A lot of, especially in our field of infection control, a lot of mature things that we've been doing for a very long time. Any other comments on it?
There's not a heck of a lot stuck on that poverty trap, is there?
No. It's very interesting that people often, money is often a reason why we can't do something, or at least we think it is. But I think what this is telling me is the reason you're not doing a lot of things is because you're doing so much stuff over here that nobody has time to think of something new. Because you're just bogged down with day-to-day stuff. So you can imagine if you did this with your team. I've done this with my own infection control team, looked at all of the different projects that we currently work on. Screening for multi-drug resistant organisms, doing surgical site infection surveillance, urinary tract, all that stuff that we do, education, etc. It's very eye-opening for a group to write those things down and put them on the board to realize where we are. The other thing is that the actual exercise itself creates conversations between people. So for example, I might think our SSI surveillance is the most rigidity trap stuck thing on the planet. And somebody else on our team may say, actually no, I think we're just getting started. And it's getting me to hear other opinions. Remember I have that problem of always acting without thinking? This is another way of getting me to stop doing that by engaging other people. They may have a very different view of the same project. And I'm not going to know that unless I engage them. And remember how we have all these hierarchies in healthcare? That me as the director of the program, they may not feel comfortable telling me their opinion. I want them to tell me their opinion, but they may not feel comfortable. But this way they can tell me their opinion. And it's anonymous. I have no idea who put what up where. Any thoughts? I'll move back here now. I'll move the microphone. Any thoughts on this as an exercise?
Should we be more balanced, or is it okay to be the doers?
I would throw it back to you, right? Who am I to judge whether you should be more balanced or not? But I think that it's, do you feel you should be more balanced would be the way I would put it. Does this make you pause and wonder if there's things you're doing them because you're doing them? I'll give you an example of my own career where, they're starting to drop off now. Give you an example from my own career where we used to do surgical site infection surveillance for a variety of surgeries at our hospital. We're a very big surgical center, transplants and hearts and all sorts of things. And we did that for several years, and every year I would have a lovely printed out thing that I would get all nicely spiral bound and I would hand to our surgeon-in-chief with a bunch of copies. And one year he said to me, I really don't know why you do this. He said, we're not really focused on this. This is something that you obviously care a great deal about, but this is not on our radar. And that was, again, a major learning moment for me in my career where I realized just because I think it's important doesn't mean they think it's important, and they're the ones that are doing the surgeries. So I stopped doing all SSI surveillance. Creative destruction in the extreme. Stopped. All of it. Because why am I doing this if the people that are doing the work aren't interested in it? Now that doesn't mean that I don't keep my ear to the ground and wait to see if perhaps something starts to change. And sure enough, over the last 10 years, there's been a real groundswell of interest in surgical site infection surveillance, quality in surgery. The US NISQIP program showed up. All of these things started to show up, and we started to have surgeons who started talking about surgical site infections, and they started approaching me asking if we could partner with them on SSIs. Absolutely. That works. That makes sense. Now we're a team. Now you care. Now you're going to act on the results. But why am I forcing what matters to me on you when I can't influence you? And so we blew up SSIs, and we waited for a time until people were interested in them, and now we're doing a whole variety of them. But it came from them, not from me. We're doing exactly the same thing with central line infections at Princess Margaret Hospital. We have a very large malignant hematology population. All of them get multiple indwelling lines for months at a time. And we used to do line surveillance all the time, high rates of line infections. They didn't care. It just wasn't on their radar. That's what antibiotics were for, was the answer, right? And so I stopped doing those. I blew up the program, I stopped it, and waited until they came around to realize that this was actually an important thing and they wanted to know what it was about. Because otherwise, you're just banging your head against the wall. So instead, by not doing those things, it freed up a lot of our resources that we could throw into other things that people did care about. C. difficile, some other issues we've been having. We've been having the problem with C. difficile that the eastern seaboard of the US had with that NAP1 strain, which is highly virulent. And so we were able to free up resources to work on other things that were also patient safety risks. But this has been extremely influential on my own practice. Now, whenever I talk about adding a new thing, the next words out of my mouth are, and what are we stopping? In order to create resources to be able to do that. And if we're just doing it because we've always been doing it, that is not a good enough reason to keep a program. I will kill it unless you tell me why we should keep this program. So I printed those out on cards because there's been a few people when I've given talks that this really resonates with. And there was one woman who actually drew one on a little card, and she kept it in her wallet, and it was kind of weird. Anyway, so just to say that you now have your own, so you can pin it up on your board if you want. But I find it a very useful thing. So again, you could do this tomorrow. Liberatingstructures.com has all of the background details on how to use these techniques, and they're pretty simple. So even if you don't remember what I said today, you can go there and figure these out.